Hello, I'm Ron Cook. I'm a family physician here at Texas Tech University Health Sciences Center in the Department of Family Medicine. And we'll go over with you a few questions that many people have regarding this new COVID virus and how it may affect you or your family. So one of the first questions that's always presented to me, and so what is this social distancing? This social distancing is that distance that we must maintain away from individuals so that we don't get infected with a virus. Or you may be what we call an asymptomatic carrier, somebody that has the virus, you don't have the symptoms yet, and you may give it to somebody else and not even know it. That magic distance is 6 feet, at least 6 feet away from somebody. Everybody's seen those commercials where you person standing in front of a black backdrop and they sneeze and this huge cloud of mist and spray comes from their mouth at, some people say, 200 miles an hour. And that cloud of infectious particles, if you're within that 6 feet, minimum 6 feet range, you could become infected with it. And so that's what we call social distancing, making sure that you stay at least 6 feet away from somebody. And that's in the grocery store, that's at the lumber yard, that's at any business, even in cars. That's not really enough distance. Now, I know families have to ride together to go do things, but certainly trying to keep your distance away from somebody, at least at 6 feet, is the best thing possible to try to avoid getting sick from somebody. Why is this important? One, not to get infected. The other thing is to what we call slow down the rate of how fast this virus is spreading. So we think coronavirus spreads quite a bit faster than, say, the normal cold or the flu that we see usually every year. This is much more infectious, about 2.5 times more infectious. So one person can infect many people, and then those people infect more people, and it just spreads so fast. And by social distancing, what we do is slow down the spread. We'll show you a couple of graphs. I'm going to have to back up here a little bit. And this is our healthcare system. This line, so this is the number of people infected, and the line across the bottom is time. Because this spreads so fast, we shorten the time that the number of people can have it. So it can just suddenly blossom or bloom where we have a lot of people infected, right? This dotted line across here is truly our healthcare system's ability to handle anybody that's significantly sick. And meaning this is the number of healthcare workers, this is the number of hospital beds, this is the number of ICU beds, this is the number of ventilators that we may have. And because this is primarily a respiratory virus, we have lots of lung issues related to this virus. And if too many people get sick too fast, we go over the ability of our hospital system to manage the number of sick people. And so what do we do when we flatten the curve? When we push this curve down where it's below this line, and that's what we call social distancing. And by doing so, we actually move this line across this way, and where it may take a little longer for the virus to run through the community, but we're below this threshold level line here that our healthcare system can take care of us. I know that if I get sick, I want to be able to have healthy people taking care of me. I want to know that I have a hospital bed. I want to know that if I need a ventilator, that there's one available. And the way we do that is keep our social distancing. We avoid being out as much as possible in large groups. And right now, the city of Lubbock has no groups larger than 10. That's hard because some families, extended families, may be more than 10. So what do? You have FaceTime interviews. You do happy hour over FaceTime. Just last evening, we had dinner with our family, my son and his wife, over FaceTime. We just need to make sure that we spread this apart so that we don't hit that threshold where we run out of hospital beds and healthy healthcare individuals that can take care of us when we become ill. One of the next questions Says, I see a lot of people out shopping and picking up food at restaurants. Are those safe? As long as you keep that distancing. I was at a local store yesterday evening, and they actually had X's on the floor at the checkout that were at least 6 feet apart. And as long as you keep that social distancing, I think we're going to be okay. I would limit the time that you're out in those community settings. I know we have to go to the grocery store. I know I have to go to the hardware store to get light bulbs or things like that. But you got to maintain that social distancing. When it talks about picking up food at restaurants, our local restaurants have done a great job about doing curbside delivery. Here's the important thing there. Make sure that you see those restaurant workers wearing gloves when they deliver food to you, and make sure that your food is hot and it maintains its temperature by the time you get it home so that it maintains hot and it's okay for you to eat. The next question I see here on my list is it true that I can have COVID-19 and not even know it? Absolutely right. At the very beginning of this, I was talking about not knowing. You may not know that you have the infection. You have the infection, it's replicating in your body, the virus is, but it hasn't replicated so much that you're shedding the virus enough to have all the symptoms, that it's causing the immune system to flare up and have all the symptoms. At that time, though, you may be infectious to somebody else. It's a sneaky little virus that way, and that's why it spreads to somebody else. What are some good ways that we can do work balance and home life? Because many of us in what we call phase 4 here are working from home. Just like you do at work, get up and take breaks. Get up and go outside. It's a beautiful weather right now here in Lubbock, so make sure you go outside and take a break. We have beautiful sunshine. Set your timer for 45 or 50 minutes. That's about as long as you need to sit still. So every 45 or 50 minutes, get up and take a walk around the block. Get up and do some exercises. What a grand opportunity to do exercise and break up that boredom during the day. Take a break and visit with your kids. Work on a couple of little projects for 10 minutes or so, and then go back to work. That helps break up your workday. The next question I have on my list here is, why is acetaminophen the best painkiller to take if I have COVID-19? Usually, well, let me back up. The viral syndrome, if you're infected, the viral syndrome is high fevers, cough, runny nose, muscle aches, joint pain, fatigue. Those are great indications to take nonsteroidals and Tylenol. So we have a number of nonsteroidals. We have aspirin, we have Motrin, we have Aleve, we have Advil, and then we have Tylenol. Tylenol has been studied to be okay during this particular virus. However, all the nonsteroidals that I just mentioned, aspirin, Motrin, Aleve, and Advil, have some worsening of the symptoms and not as good as outcomes unless we just take Tylenol only. I would do my best to avoid that class of drugs, nonsteroidals, because just the outcomes so far have shown that people who take those while infected with this virus don't do as well as compared to those individuals who don't take the nonsteroidals. If you can avoid it, avoid the nonsteroidals. Nonsteroidals, Advil, Aleve, are hard on the kidneys to begin with, and during this time that you're particularly ill, you're not probably drinking enough fluids, and it's hard on the kidneys, and dehydration is hard on the kidneys, and you add the nonsteroidals on top of that, it can be even harder on the kidneys. And so we see so far that people who take nonsteroidals during this virus may have significantly poorer outcomes than those that don't take that. So I would recommend that you don't take nonsteroidals. What if you're allergic to Tylenol? It's going to be pretty tough. You're just not going to feel very good, unfortunately. There's not a good replacement for nonsteroidals if you're allergic to Tylenol too. What does community spread mean, and how should we behave differently that COVID-19 is in our community, and we do have evidence that it is community spread now. Community spread means you didn't get it from somebody that traveled, or you didn't go someplace and then bring it back. Community spread is somehow somebody already was sick. You may or may not have known that, and you had a close enough proximity to that viral cloud that somebody coughed out or sneezed out, and you picked up COVID virus from the community, from somebody in the community, and didn't even know it. And so now you're infected. Now your family members, you have the potential to infect a family member. So let's talk about that a little bit. So you're sick. You should absolutely stay home. You do not need to be out in the community. You may have the sniffles. You may just start to be feeling poorly. If that's the case, you get home and get to bed and stay away from everybody else in the household. You don't need to be out running around and potentially infecting somebody else. And remember, this virus is really infective, so it's easily caught by somebody else. The best thing that you can do if you are ill, the best thing that you can do is stay home until you start to feel better. That's what community spread means, okay? What are the best cleaning products? Should I use at home to protect my family? Any of the commercially available cleaning products are just fine. Those like Clorox or Lysol or any of those cleaning products are just good. Here's the important thing. If you're taking care of somebody that's ill, clean those high-touch surfaces frequently. Doorknobs, bathroom sinks, nightstands, the kitchen sink, the bathroom. Clean those areas frequently to keep that viral burden down in the household. Wash those linens, wash their pajamas, those sorts of things. If you're taking care of somebody, limit your exposure to that person as best as possible. Make sure you stay out of the bedroom as much as possible. You can go take them some Gatorade, you can take them their dinner or their breakfast. Go in their room, leave it on their nightstand and leave. Talk to them from a significant distance away, okay? That way you're not in that viral cloud or that infectious cloud that may be in the bedroom. And so do your best to try to stay away from it. I know that's hard, especially if it's a family member, a loved one. That's hard to do. The other thing to do is move to the couch, move to the other bedroom. Don't stay in the same place. I would not sleep in the same bedroom, if at all possible, with somebody that's ill. Another question is, because some COVID patients experience minimal symptoms, is there a way to determine if a person has already had the virus and recovering without even knowing it? No, our tests today truly show if you're positive, you have the virus, and negative if you don't have the virus. So we call those a qualitative test. We don't right now have a test that measures the amount of virus in our bloodstream. And right now, either you're positive or you're negative. So we don't have enough testing capability to test everybody to make sure that they're negative. And so there's a sort of a magic window that we've talked about. It's 72 hours or 3 days without symptoms and without any kind of Tylenol. So you have to have 3 days minimum plus 7 days. So it's 7 days minimum, and 3 of those days must be consecutive without fever and without Tylenol. So you must be completely normal, without symptoms, and without Tylenol, and without fever for 3 days and a maximum of 7 days in there, okay? When will this peak? The last question asked me is, when will this peak? We have no idea. That depends on you, and that depends on me. That depends on me and you maintaining that social distance, making sure we push that infection rate out so that we keep that below the threshold of our healthcare capacity. Many people are going to be just fine with this. Many people are not going to have enough symptoms that warrant being in the hospital. And let's pray that you and I are one of those, okay? Because we know that there are many people that are going to need the hospital, especially those that have what we call comorbid conditions, those high-risk individuals, people with lung disease, people with heart disease, people with diabetes, and the older patient population. I like to call those the more mature people, are people that have a lot of experience. Those people are at much greater risk of needing hospitalization. So we must save those hospital beds and ICUs for those individuals. And you and I can do our part by keeping our distance from those and staying out of big groups where one person can infect the whole group. We really must, I can't emphasize enough, staying away from people, keeping our social distance away from people to protect the ones we love that have lung disease and heart disease and diabetes. Those are all high-risk populations. So do your best. If you have any questions, I'm happy to answer more questions. I appreciate your time today, and feel free to let us know if you have any more questions. Thank you for your time. Stay safe, wash your hands, and stay away from people. Bye now.